Thank you for joining us. Welcome to Your Health. I'm your host, Lisa Hart. Well, as you know, for the last 16 months, it's been quite a difficult situation for many of us, really all of us. Today, I'm joined by Dr. Adam Solomon here from Memorialcare. And, they were very instrumental in helping us get through the pandemic as well as helping with the vaccines. Well, Dr. Solomon, thank you for joining me. How are you today?
Great, and thank you for having me.
You're welcome. Now, as I sort of did the intro, Memorialcare has been here a long time, Saddleback Medical Center, and really has been one of the first hospitals here for the residents.
It has, and with the expansion of Memorialcare Medical Group and all of the services that we provide for just ongoing regular care as well, we're really happy to collaborate with Laguna Woods Village. Which
you have done an amazing job over always, but then most importantly over this whole COVID-19 pandemic, which has really thrown us for quite a loop in many aspects. What are some of the things that you saw happen over the last several months?
Since the pandemic starting to slow down, are you talking about?
Well, or let's go even further back. Let's go from the very beginning. What are some of the challenges that you guys had?
Oh, there were so many challenges. And initially, of course, fear came along and people were afraid to come out. And we had to sort out, what do we do to make sure that people are able to access care without exposing themselves potentially to getting infected with the virus. Mm-hmm. So we needed to figure out how to do virtual care so that patients can get care from the comfort of their home without having to come in. Mm-hmm. But then also people coming into the emergency department, because emergencies still happened. Right. Sometimes that they were due to COVID, sometimes that they weren't. And we didn't want to commingle people that maybe had an infection with people who didn't have an infection. So how do you identify them earlier? How do you keep them separate? How do we make sure that our staff is safe when managing all those patients, and also that they are not at risk for bringing an infection from one person to the other?
Right.
Fortunately, we had an amazing staff that was able to keep all of our physicians and nurses and employees adequately complete with PPE, that protective equipment. Mm-hmm. And so we never had a time like some of the other hospitals did where we didn't have enough of that protective equipment for our staff.
Great. And then I had spoken with Marcia not too long ago, and she mentioned that Saddleback Medical Center really didn't experience many of the same things that some of the other hospitals did regarding COVID-19.
Yeah, it's amazing. We were tracking throughout the day, every single day for months, the volume of patients that were coming into the emergency department, that were being diagnosed with COVID, tested for COVID, and getting admitted and cared for, and how full our ICUs were. Mm-hmm. And we saw the numbers blossom significantly at Long Beach, and also somewhat at Orange Coast and Fountain Valley. Mm-hmm. But Saddleback Medical Center, it did get a fair number of patients, but not to that same level.
What do you attribute that to?
I think people were very conscientious about the things that they were told to do, wearing their masks, staying safely social distance, and just being careful. I think that made a tremendous difference. And that was clear throughout the country. In those areas where those things were either required or strongly encouraged and people followed them, you saw far lower percentages of people in the hospital with severe COVID.
That's great. It's great. And like you mentioned, we here in the village, the folks did such a great job of following the guidelines. They stayed inside. And at the very beginning, I'm sure there was a lot of fear. And one thing that I think is interesting is that more and more now, things are coming out about people having isolation and depression, not just in young people, but in the elderly as well. What are some things that Memorialcare is going to do regarding that?
Yes, absolutely. And those things can persist far longer than the pandemic. And so we've rolled out a few different things that help tremendously with that. One is there's often been a divide between behavioral health, mental health illnesses, and physical. And so we've integrated those together in some of our offices as a pilot, and we're expanding that. It's called the collaborative care model, where the primary care physician has additional behavioral health support through a licensed clinical social worker who can help patients with therapy, and also will communicate with a psychiatrist to help guide the primary care physician in management of their depression or anxiety. In addition, we rolled out something called Silver Cloud. This is an online web-based tool that we've decided to provide at no cost to the entire community. And it's a series of modules that people can go to at their own pace, learn about how to cope with things that might be causing their depression or anxiety, or maybe difficulty with sleep. We can often have a coach that can help guide them to the modules that'll be most helpful for them. But the people who have gone through it, we've seen a dramatic improvement in their level of depression or anxiety.
So give me an example of what kind of a module you're talking about. Like if I was feeling anxiety, is that like a module? You would go towards something like that? It would be based on what they're feeling?
Yeah, there'll actually be a series of modules, things that help with something called cognitive behavioral therapy, which sounds very fancy, but it really is to help people change the way that they perceive things. So the things that make us anxious are often things that are outside of our control. We worry about things, but we have absolutely no ability to control what happens, and that's not very functional. So it helps to change the way you perceive those things so that they don't make you feel as anxious.
That's great. I mean, I think that's something, and that you're offering that as a no cost to people, I think is very helpful. And then again, it is an online thing, so they could do it right out of their home, and they don't have to travel anywhere, which is great. And that'll bring me to the next thing that we've done so much of is obviously the virtual communication through our Zoom. I think it's saved us as a television station and as a program, and it's been very helpful. And we've interviewed many of your physicians that way, and it's been great. And I'm imagining you'll keep that in sort of part of your practice.
Absolutely, and we have the ability for people to do virtual visits scheduled with their physician instead of having to come into the office. They can do it from the comfort of their own home. We have virtual visits for urgent care. So if somebody has an urgent need, instead of having to come in for many conditions, they can get in what's called a virtual queue and just wait for the next provider who's able to see them and to assess them online. If they don't want to wait, we'll have an option where they can select a physician from a list that they can then schedule an appointment for later on, that they can get their needs taken care of. The other thing that we rolled out last year is an artificial intelligence chatbot. So if you go to our webpage, memorialcare.com, down in the bottom right corner, you'll see this little symbol for chat. Clicking on that opens up this AI chatbot where people can get information or their questions answered, but also for certain conditions, it will lead them through a series of questions to help understand what's going on with them, what it could be, and just to make sure that it's nothing more concerning that would require a visit. If it is, it'll help guide them to getting an appointment to get one of those other methods of care. But if not, it can package all of that information up, give it to one of our providers who can then make the diagnosis and the treatment digitally, and it all gets taken care of. You don't actually have to even speak to somebody.
That is great. In fact, I've actually used something like that, I think, for insurance. And, the one thing that is interesting is that, like you said, it'll lead you all the way through. But then at the end, it's like, well, now you can't answer the questions. Let me find you somebody, because it sort of gives up on you, and then it finally gets you to somebody. But that is if you have significant questions. The other stuff that you're talking about, just the basics, it's really quite easy to handle.
Yes, but it can lead you through, and if it is one of those things that the doctor can take care of just based on that history, it'll finish it up and you'll be done, and a prescription will be called in or something will be done for you to take care of what the problem is.
So let's go behind the scenes. So tell me how first you handle the virtual emergency doctor visit, because I think that's very interesting. If I'm calling in and I just broke my ankle and I'm not going to come to emergency services right away, and I'm going to talk to this virtual doctor, how at your end are you handling that virtual call?
Yeah, so emergencies are somewhat different, and certain things like a potential fracture, generally you need to get seen in person at some point. Those can't be done. But there are some things on the edge that you don't always know. It seems like something that potentially could be managed virtually. And so a person might start off with that video visit with one of our providers. And then as you go along, realize, no, I need to really examine you. You've got abdominal pain, but I can't tell just by talking to you. I need to examine you. And then we'll have the person scheduled to come in to get seen if it's something that is not an emergency. If it truly is an emergency, of course, we'd have them get to the emergency department. But if we do have to flip, then they're copay would be waived so that they wouldn't have to pay for the visit because they didn't get their problem solved at that time.
Oh, I see what you're saying. Okay, so then if at some point during that virtual call you realize that they have to come in, now does the emergency services operate a little bit differently now where instead of just going in without an appointment, do you have an appointment?
Emergency, no. Urgent care, yes.
Oh, gotcha. Okay. All right, perfect. All right, well, we're going to take a little break, and then we come back. We're going to talk about the collaboration that we have had over the last 16 months.
Great.
All right, come on back, and we're going to talk to Dr. Solomon about the vaccination clinics that happened right here in Laguna Woods Village. Stay tuned.
Hey, beach walkers, grandkid chasers, stair climbers, dance lovers, weekend warriors, and yogis. Your life demands activity, and joint pain shouldn't hold you back. Get personalized joint care that's as unique as you, with high satisfaction rates to prove it. At Memorialcare, your joint replacement patient navigator will be by your side, helping you safely return to more. Like another beach, extra hug, and one more song. More from life is calling with Memorialcare.
Welcome back. Well, I am still joined here with Dr. Adam Solomon, and we are going to talk about the vaccination clinics that happened right here in Laguna Woods Village. Well, it was quite a feat. 17,000 vaccinations were given right here to our residents, and it's a remarkable situation. Happened very quickly, working with the staff here as well as your staff. Tell me just a little bit about how it came about.
Oh, it was a wonderful collaborative effort. The Laguna Woods Village reached out and coordinated with Memorialcare to make sure we had enough vaccine, and then a space to provide those vaccinations, and then the organization of getting people out and not having them have to wait. We had a few hiccups at the very beginning, worked them out, and got so many compliments from people of how efficient it was to come through, get their vaccination, wait to be monitored, and then to get back home again.
Right, and so many volunteers came out from Memorialcare, husbands, wives, folks from here. I mean, it was quite an effort, and I think it's awesome. And like you said, you've gotten great feedback. And what are some of the things that some of your volunteers or even your staff have felt regarding that?
Well, the warmth and appreciation from the people that were getting vaccinated was just tremendous. That it was so rewarding to come out and be able to provide a service that people really wanted. People were very scared at the time, and I think there's still some fear today, but people are realizing how valuable those vaccinations were now. And they were desperate for them. So many people, you were hearing stories at the time of people not being able to get those vaccines.
Right.
And just the relief on people's faces, knowing that they were getting closer to hugging their grandchildren again or seeing their family in person again. The video or the phone is nice. It's just not the same as seeing your family and your friends.
Yeah, it's not the same. And as we are experiencing now, where we're out there getting out and about, you know, it's been wonderful. But something that you mentioned off camera is that people are still a little afraid. What do you think the fear is from?
It's true. I think part of it is just hesitancy, getting used to this change of knowing you can go out and be in a place with other people. Potentially people think of a doctor's office as a place where people are sick, and so they worry that they might get something from going to the doctor's office. But we have protocols in place that we've had that are excellent, keeping things clean. We don't have people sitting in the waiting room. They're able to get back to the exam room. It really shouldn't be the worry that people have about coming in. And I think there's also a little bit of inertia. People have gotten used to not coming into the office to get seen. And we need to get past that. Unfortunately, we have been seeing some people that delayed getting care a little longer than they probably should.
Yeah.
And the consequences of that sometimes can't be undone.
Wow, you know, that is frightening. And as we were talking off camera, you know, many of us, I think, like you said, we've been kind of not used to doing any of this. So now we've gotten used to not doing anything, but now we have to kind of ramp up. And certainly it's concerning if somebody has definitely got something critical
Yes.
that they need to come in for.
And some of the things that we're talking about, though, are things that they wouldn't necessarily have symptoms for. So that's why we're encouraging people to come in for their annual exam, just to get checked to make sure that there's nothing going on that they're not aware of. And things like cancer screenings. The reason you do a screening, specifically, that means a person who doesn't have any symptoms so that you can catch something earlier.
Right.
By the time the symptoms occur, things have progressed, and we don't want to get to that point. So breast cancer screening and colon cancer screening and things like that, as well as maintenance of chronic diseases, people who have high blood pressure or diabetes or high cholesterol. Those things really need to be monitored to make sure that they're being adequately treated, and that often does take a visit to the office.
Well, and also I'm wondering if people who started out, prior to COVID, let's say they had high blood pressure at that time, well, maybe even over this last several months, maybe they don't have it. Or maybe they probably do, but maybe it's not as high, or they need some adjusting.
Yes, and the other thing, people have called COVID-19 the COVID-19 because of the 19 pounds that people gained from sitting at home. Their diets maybe weren't as good, they weren't getting exercise, they weren't getting out. And so with that increased weight often comes things like high blood pressure and even diabetes.
Exactly, yeah, I'm sure we all weren't eating very well there for a while because we were cooking everything at home.
Yeah.
I mean, it was definitely a challenge. So let's talk about if people do want to have some of those services. I know you have expanded your offices. There's medical offices now that they can visit rather than going to the hospital. Tell me about that.
Yeah, absolutely. So we have, at the beginning of last year, we opened a new office right on the corner of Moulton and La Toro. That is a primary care office. It's a beautiful new office, lots of parking. We have family medicine, internal medicine, lab draws. So that's a great option.
So tell me a little bit about the concierge call line. So it's specifically for Laguna Woods Village residents only, correct?
Correct. Yes.
And so what does it actually offer?
So we have telephone advice nurses that can help with any questions about care. And then also we have concierge staff that can help schedule one of those virtual visits that I was talking about, or even an in-person visit, help people to find a primary care physician or even a specialist.
Okay, that's great. That's nice to have. What if someone wanted to call that concierge number and they wanted to set up a virtual call? Did they help them do that too?
They can. They can help them set up a virtual visit as well.
Okay, all right, great. Going forward, what are some exciting things that Memorialcare is going to be doing?
Well, we continue to expand. We are both expanding in our geography, our numbers of offices, as well as services. Just at the beginning of this year, we added physical therapy as a joint venture. So we are now one of the largest providers of physical therapy in Southern California, with offices conveniently located throughout the region.
Okay.
We continue to look at expansion of our imaging centers to make sure that those are available and convenient for everyone. We've brought in a new obstetrics group, so that's expanded our obstetrics and gynecologic services for women in the community. And so we continue to look for what services are most at need and that we can provide excellent care for everyone in Orange County.
And I know not so long ago you have an accreditation for the elderly population now, so that helps take care of all of their needs as well.
Yes, at Saddleback Medical Center, we got that designation for the care for elderly care.
That's great. That's
Yes.
great. Well, thank you so much for going through all of this with us for the last 16 months and for recapping it for everybody, just to get a good idea of what it took to make sure that this all happened. So thank you.
Thank you so much for the opportunity. And again, just wanted to encourage people that we are open, things are safe. It's time to come out and make sure you're taking care of your healthcare needs that you may have forgotten over the past year.
Excellent. All right. Well, thank you.
Thank you.
We hope you've enjoyed this episode of Your Health, and please join us next time as we learn more about your health.
At the Memorialcare Breast Centers, our sole focus is to save lives through annual mammograms. We've implemented the following safety measures to keep you safe during your appointment. All patients are screened upon entry and will be asked to wear a mask. Waiting areas and dressing rooms have been rearranged and are being disinfected more frequently. Appointment times are staggered for social distancing. All staff are screened upon entry and wear appropriate PPE. Our standalone breast centers are located throughout our communities, and with easily accessible locations from Long Beach to Rancho Mission Viejo, we're here for you, close to home.